Good morning. This is Dr. Gardner, and I will be doing a brief lecture on anxiety disorders in children and adolescents. So, what are some of the things we think of when we talk about anxiety? Panic, stress, feeling anxious, feeling sick, being in a state of kind of like a shock. There's so many different ways that patients, especially children and adolescents, explain anxiety, which is not quite the same as an adult. So that's what we're going to focus on in this lecture. Okay, let's see. So that for children, it's feeling anxious. They have this feeling of anxiety. So that's what our focus of this is going to be. Just the feeling of anxiousness and how it festers or manifests in children. So when is worry too much worry? So some of the things that we'll be referring to are coming out of Kaplan and Zadok's chapters 52 and 50.1, and it discusses separation anxiety, generalized anxiety disorder, reactive attachment disorder, social anxiety, and disinhibited social engagement disorder. And you will need to know all of these, so be very familiar with all of these topics. So separation anxiety, F9 3.0 is the ICD-10 code. That is excessive fear from an attachment figure. The peak onset is between 7 and 9 years old. A diagnosis can be made after 4 weeks. And children with separation anxiety tend to complain mainly of some type of stomach ailment. Whether it be nausea, vomiting, diarrhea, stomach aches, but some type of GI upset is usually the most common physical complaint with children with separation anxiety. Some of the symptoms that they may have is refusing to go to school because they don't want to leave that attachment figure. They don't know what's going to happen. Is that person going to be there when they come back? Will that person leave them and never come back? So they don't want to leave. They may have trouble sleeping or nightmares. They may be very, very clingy to that source of attachment for them. They have extreme worries about sleeping away from home. So this is a child that they may really want to go to a sleepover, and their parents may drop them off and they play with the other children. But when it's time to go to bed, they need to go home. They can't stay. They need to get home. So they play long enough, but they've got that separation anxiety. They want to go back home. And again, frequent stomach aches as well. So when we talk about generalized anxiety disorder, what is that? That is that restlessness or feeling keyed up or on edge. They may be easily fatigued. They may have some difficulty concentrating or their mind going blank. And you look at these symptoms and they mimic other diseases or other diagnoses, correct? Yeah. So that's why we use the DSM-5 TR, and we make sure that the symptoms that the patient has is the symptoms that go with the actual diagnoses, because some of them overlap. That difficulty concentrating and mind going blank, being easily fatigued, irritability, sleep disturbance. You may see those with other diagnoses, okay? Also, muscle tension. So, generalized anxiety disorder, you may have that restless or feeling keyed up or on edge. They may have the muscle tension. They may have sleep disturbance, which is either falling asleep, staying asleep, or restless sleep, or all. Irritability, difficulty concentrating, or their mind going blank. So, what is there to worry about? They worry about everything. Everything. These people, these little adolescents or children, they're usually perfectionists. They're overly sensitive. They have a need for reassurance. They have a very negative self-image of themselves. It could be performance anxiety. They could be worried about having to speak in front of a class or having to perform at a track meet. It just could be some kind of insecurity about their competence. You know, how well are they going to do on an exam? They could be worried about their expectations about the future, things that they cannot control. So what is the treatment? The first line treatment, of course, is CBT. First line. For generalized anxiety disorder, we're going to do some therapy. Pharmacology, we may use fluvoxamine, which is Luvox. We may use fluoxetine, which is Prozac. We may use sertraline, which is Zoloft, or paroxetine, which is Paxil. For these medications, you do need to know the initial dose for a child or an adolescent. So, again, for these medications, you will need to know the initial dose for an adolescent or a child when you're prescribing, okay? Alright. Same medications, just added duloxetine and tofranil, which is a TCA. So let's move on to social anxiety disorder. And what is social anxiety disorder? That's a social phobia, right? That's usually when they have to perform, like if they have to get up and speak in front of the class or perform something in public. They have an excessive, persistent, impairing anxiety. That anxiety about being scrutinized in social or performance situation must occur in peer settings. So small children may exhibit crying or tantrums or freezing up. I can tell you, when one of my daughters was little, she was maybe, I'd say 4. Yeah, she was maybe about 4 or 5. And she had been taking dance lessons all summer. And then came time for them to do their parent show-off day. All dressed real cute in their little costumes. And so I had 2 daughters. One started doing the dance as soon as the music came on. The other one stood there and started bawling, crying. I want my mama, I want my mama. And I'm sitting right directly in front of her. She could have reached out and touched me. But she froze. She had a fit. So she was expressing symptoms of a social phobia. It was performance anxiety. So she had practiced and she knew her dance. But when it came time to do that in a public setting with all the other little children there and the parents, she couldn't do it. She froze. So that is a form of a social phobia. Now, would she have been diagnosed right then as having social anxiety disorder? No, because that is just one incident. But I want you to think about that example when you're thinking of social phobias. That's how little children may exhibit a social phobia. Okay, so, ignore that, teachers, how to use that template. I don't know why that's still on there, but since the exam is coming up, we're just going to leave it. Alright, so let's talk about reactive attachment disorder. Reactive attachment disorder is young children who show no consistent evidence of selective attachment. So they rarely engage in socially reciprocal interactions with adults. So they are kind of like awkward. So they don't have any engagement. So they have like that attachment disorder, reactive attachment disorder. Whereas children with a disinhibited social engagement disorder, they're on the whole opposite end of the spectrum. They have no inhibition when approaching or engaging with unfamiliar people. So, like, think of this little girl in the park. You would think, okay, oh, she's with her papa in the park. No, this is some strange man she's never seen in life. So, That's how I want you to think about disinhibited social engagement disorder. Some little child in the park going hug Papa, who's not Papa. She's never met this man before, but she's going to hug him. So she has no inhibition. She has no fear of this man. And why? So we want to kind of look back at what type of children would have this type of behavior. So I want you to go in and do a little digging on that, because you may see a question on your exam about the type of child you would expect to have disinhibited social engagement disorder. Okay, now let's quickly go over some of the side effects of SSRIs. Of course, you know, an SSRI, if we give it for anxiety, it may induce a manic reaction in a child. So even though we have not gotten to mood disorders, you need to know if you prescribe an SSRI, that child may have a manic reaction. Okay? Manic reactions are distinguished by the presentation, time, course of onset, response to discontinuing the medication. And they may have manic symptoms versus activation symptoms, which we'll go in a little bit more in the next module. But children who take SSRIs, big black box warning, have a risk for increased suicidal behavior. Children and adolescents who take SSRIs have a risk for increased suicidal behavior. That is a black box warning, but you always want to make sure you're letting those parents know about, you are educating on that black box warning. What about the side effects of SNRIs? They're pretty much the same as the SSRIs. You also may have some nausea. They may worsen anxiety, and you can let your patients know, hey, this may, starting an SNRI, you may have some worsening anxiety at the beginning, but it should be transient. That should go away. Those headaches may have increased heart rate, increased blood pressure with an SNRI. So you have to be careful if your patient has a history of hypertension, if you're going to give them an SNRI, right? And if they come to you complaining of palpitations, you need to check their medication history. Alright, so always check your history, always check your medications when your patient is complaining of side effects. What medications did you do? Did you do anything different? Are they starting any kind of new medications? What are you going to check if they are on an SNRI and they're coming in and they're complaining of headaches? What are you going to start to check for? So let's get back to assessment and start thinking about those. Your patient comes in and they've been on medication, they just started this SNRI and they're having headaches. What are you going to do? Alright, let's move on quickly to side effects about the tricyclic antidepressants or TCAs. You'll have those anticholinergic side effects like dry mouth, urinary retention. They may have some constipation. You may also see they have elevated heart rate, or they may have orthostatic blood pressure. Those are some of the side effects of the TCAs. And I think we're almost done with these slides. Oh, that might be the last slide. Yep, that was it. Alright, that is your brief lecture. Consider that a little present on children and adolescents with anxiety disorders.